Every month, hundreds of children end up in local hospitals needing mental health care. A new bill aimed at helping them is now sitting on the Governor Newsom's desk.
News 8's Regina Ahn has details on the bill and why doctors say it's an emergency that needs to be addressed.
It's being called a crisis. Children as young as 5 years old needing mental health treatment. A doctor here at Rady's Children's Hospital says 10 years ago there was about 40 kids entering the hospital. That number has jumped now to more than 400 a month.
More and more coming in with depression, anxiety, and thoughts of suicide. What's driving this? Kids, even before COVID, were more and more socially isolated.
Dr. Ben Maxwell says everything from the pandemic, demands of school to cyberbullying has caused an influx of kids needing psychiatric care in emergency rooms.
It's a crisis that we're seeing not only here in San Diego County, across the state, and really across the entire country.
Maxwell says there are not enough hospital beds for children who need immediate help, which in turn leaves kids waiting for days to see a specialist.
Probably started about 10 years ago when we really first started to see the increase in kids with behavioral health needs arriving at Rady Children's Hospital.
A new bill approved by the state legislature may help address those staggering numbers. Bill AB 226 would provide one-on-one care to children in a home-like environment with counselors and psychiatrists. It would mostly benefit kids in foster care, low-income families, and other children on Medi-Cal.
So they can get that sort of therapeutic, compassionate care to then help them get back to normal life after a few weeks of that type of treatment.
The governor has until October 10th to either sign or veto the bill that would also allow nonprofit organizations that specialize in children's mental health to collect federal dollars to operate beds and treat children. Maxwell says another benefit to this bill is the amount of time children will be able to stay to get the necessary help they need.
A lot of these residential treatments are more like 3 weeks or 6 weeks, somewhere in that order of time.
A sponsor for this bill, Adrian Shelton with the California Alliance of Child and Family Services, says the crisis has only increased during the pandemic.
We already had a crisis in children's behavioral health prior to the pandemic, and we can look at statistics there about suicide being the second leading cause of death among adolescents and hospitalization rates increasing.
If the bill is signed, it will go into effect January of 2022. The governor has supported the idea of children and behavioral health, but experts say there is a critical gap of crisis care that needs to be addressed for kids. That's why they say this bill is so important.